Hello, my name is Ted Drygas, CPO and Chairman of the New York State Insurance Committee. I'm pleased to have join me today is Matt Johnson, my co-chair in this committee.
Hi, I'm Matt Johnson, physical therapist, regional director with Hanger Clinic, as well as member of the Insurance Fairness Committee. We're going to chat with you a little bit today about our New York Medicaid patient access to care issue, talk about the problem and what's creating some of the patient access to care, our insurance committee collaboration with other interdisciplinary team members, and some key milestones we've achieved and our plan moving forward.
The New York Medicaid fee schedule hasn't changed since 1987. This is dramatically affecting people's ability to get O&P care and for facilities to provide care. Medicare has added codes and technology, and Medicaid has not followed suit. The Medicaid managed care plans, workers' comp, and no fault all follow the Medicaid fee schedule, and many of them are discounting deeply off of that or going through additional brokers to even further decrease the reimbursement to facilities. The safe harbor law states that Medicare is the lowest reasonable rate, and Medicaid and the discounting is dramatically below that. And our efforts are to bring the New York Medicaid fee schedule up to Medicare and include the fees that are no longer or not even included in the New York Medicaid schedule.
So those challenges that Ted has communicated has led to roughly 30 O&P sites closing over the past 10 years. We do need your help to collect more information on this because it's not widely documented over closed O&P sites. Those that still are in operation are sometimes challenged due to low reimbursement rates and staffing in order to service the population. The results are some technologies are just flat out not available to New Yorkers with Medicaid. Some of our community have to travel further to see an O&P professional. They often have to wait longer to receive their device due to those challenges. Our coalition team formed in 2019 at the spark of Ted and his work. We've involved clinical, administrative, patient advocate, and regulatory experts. We've partnered with Ashley White and the AAOP team, who have been excellent at providing some resource, some data analytics, as well as outreach to advocates. We've networked with other states that have had similar challenges with their Medicaid and access to patient care, most notably Illinois and California. We've leveraged you all, our New York chapter members, and we're also reaching out to those that have had legislative experience, either working on patient access to care issues or working with lobbyists in the past. We have gotten some patient advocacy group support. Amputee Coalition, American Academy of Physical Medicine and Rehab, CP Associations of New York, MS Society, the CMTA, and New York Physical Therapy Association all have been oriented to some of these challenges and shown support, as their membership are often individuals receiving care and O&P services. Lastly, we've key members with our collaboration have been our New York legislative leaders. We've secured champions in the Senate, being John Mannion, and in the Assembly, Aileen Gunther, currently working with different committees within the Senate and the Assembly and engaging with the governor's budget team to align the three arms of New York legislature, the governor's office, the Assembly, and the Senate to enact budget change. So kind of walking through the milestones in our plan, our initial legislative contact happened August of 2019. We began, and that was through Ted's work. The Insurance Fairness Committee started taking form in March of 2020. Through some meetings, we were collecting information, networking with our colleagues. We interviewed lobbyists, exploring hiring a lobbyist to assist us in enacting budget change. Gained a lot of information from that, began outreach to different legislative leaders. We did secure our first legislative champion in the Assembly, Aileen Gunther, in the fall of 2020. She committed with her team to champion a sign-on letter and network with other Assembly team members, which we did, and gained more information and more support. That led to a sign-on letter being launched in early part of 2021, February. That went out. We leveraged AAOPA's email blast system to get more, and our membership sending letters to their local legislators, our patients, our allied healthcare professionals that work alongside us. All were outreach with this email blast, and that led to 12 co-signees of Assemblywoman Gunther's sign-on letter in February. We are mounting a push to get budget change in the session that took part in March. So in March, we did not enact budget change, but we increased awareness, and were able to also secure our first Senate champion, John Mannion, that occurred in April of 2021. His healthcare team is very supportive of our efforts, and also introduced a study bill in June that was then also introduced in the Senate as well as the Assembly, that is forcing the government to study the funding or underfunding of Medicaid for O&P services. So that's Senate Bill 7023 and Assembly Bill 7892, which takes us to our next steps that we continue to outreach. And you'll have a link in the insurance section of the New York chapter website. It takes about a minute to fill it out. It actually automates us sending an email to your local legislator asking them to co-sponsor this study bill. So our next focus is to improve co-sponsors for these bills, as well as initiate a Senate sign-on letter and repurpose the Assembly sign-on letter entering the next budget cycle. We also have a next step of garnering further support from the government, the governor's office, his budget team, and the healthcare side of that, to navigate their guidance for enacting budget change. And ultimately our goal is come March of 22 to have a line item increase to the budget that would improve access to patient care through some of the challenges that were mentioned earlier.
We want to thank you for your participation and your increased participation in our plan to move forward. And we look forward to speaking to any of you. Just email us. I'm ted@carecrafters.com. And Matt, you're
MA Johnson at hanger.com.
Thank you.